Today we're tackling a really important topic, getting a better understanding of cerebral palsy, or CP.
That's right.
We've looked through quite a bit of material medical guides, some really insightful articles, and personal stories, too.
Yeah, a good mix.
The idea is to give you a solid, clear overview of CP, especially thinking about individuals who use wheelchairs.
And we want to keep it manageable, get the essentials without drowning you in technical stuff.
Exactly, extracting the core knowledge.
We'll start with the basics, the medical side of CP. Then we'll move into practical caregiving, evidence-based stuff, focusing on transfers for wheelchair users.
Okay.
And finally, wrap up with daily management, routines, therapies, that sort of thing.
Great, so let's jump right in. Medical fundamentals. What exactly is cerebral palsy?
Okay, so CP isn't like one specific illness. It's actually a group of disorders.
It's a group, right?
Yeah, affecting movement. And they all stem from some kind of damage to the brain.
Damage that happens early on.
Exactly. Before, during, or sometimes shortly after birth. The main impact is on the motor system.
So coordination, balance.
Uh-huh. Balance, how you control movements. And a really key point from the sources, it's static.
Static, meaning?
Meaning it doesn't get progressively worse over time like some other conditions. The initial damage doesn't spread or worsen, though the effects might change as a child grows.
Okay, that's important. So what causes that initial brain damage?
Well, the majority of cases, and it's actually a pretty high number, start when the baby's still developing in the womb.
In the womb, not necessarily at birth.
Correct. Often, even after looking into it, the specific cause isn't found. That's what doctors mean by idiopathic.
Oh, okay.
But we do know some risk factors. Lack of oxygen at birth, which people used to think was the main cause, it accounts for maybe around 10%, so smaller than often thought.
Interesting. So what are the bigger factors then?
Prematurity is a really significant one,
Yeah.
especially for babies born very early, weighing less than, say, 3 pounds, 5 ounces. Their brains are just so vulnerable.
Right.
Multiple births, twins, triplets also increase the risk, often because they tend to be born prematurely.
Makes sense.
Then there are maternal infections during pregnancy, things like CMV, rubella, toxoplasmosis, Zika. Even some bacterial infections or a high fever in the mother can play a role.
Wow, okay.
Severe jaundice in a newborn, if it's not treated properly, can lead to something called kernicterus.
Kernicterus.
Yeah, it's brain damage from too much bilirubin. That's another cause. Birth complications are still relevant, placental detachment, issues with the umbilical cord, things that might cut off oxygen. Certain health issues in the mother, like thyroid problems or seizure disorders, exposure to some toxins. Methylmercury is one mentioned.
Right.
And even assisted reproductive technology, like IVF, seems to have a slightly higher association, possibly linked back to the higher rates of prematurity in multiples.
Right.
And finally, there's growing evidence for genetic factors. Maybe around 14% of cases might have some underlying genetic link or predisposition. It's an active area of research.
That's a lot more complex than I realized. So many potential pathways.
It really is.
And I see CP is classified into different types. How does that work?
Yeah, the classification helps describe how movement is primarily affected. The most common type is spastic CP.
Spastic, what does that look like?
It means the muscles are stiff, tight, movement feels restricted, and interestingly, its prevalence seems to have gone up a bit.
Oh, why is that?
Well, partly because advances in neonatal care mean more very premature babies are surviving, and they are at higher risk for this type.
I see. Okay, what are the other types?
There's dyskinetic CP. That involves involuntary movements, sometimes writhing, sometimes more jerky
Okay.
than ataxic CP. The main issue there is poor coordination and balance, especially with walking, if they can walk.
Mm-hmm.
And it's actually pretty common to see mixed types where someone has features of more than one of these.
So someone could have both spasticity and some involuntary movement.
Exactly.
Beyond these movement issues, are there other medical problems that often come along with CP?
Unfortunately, yes. Because the brain injury can affect different areas, other issues can co-occur. Epilepsy is quite common.
Right.
Intellectual disabilities, learning disabilities, ADHD, those are frequently seen. Speech impairments are common too. And difficulties with swallowing, which can be quite serious.
Yeah, I can imagine.
Others might include hydrocephalus, that's fluid on the brain, vision problems, hearing loss.
Oh, quite a range.
Definitely. And then there are secondary health problems that can develop because of the CP. Things like poor growth, sleep problems, poor nutrition.
Because of the motor difficulties.
Yeah, exactly. Difficulty eating, maybe positioning issues affecting sleep. Also, things like upper airway obstruction, risk of aspiration pneumonia if swallowing is difficult,
Mm-hmm.
reflux, dental problems, higher risk of fractures because bone density can be lower, hernias, constipation is very common, bladder control issues, sometimes drooling.
It's really a whole body condition in many ways, isn't it? Even though the origin is the brain.
That's a good way to put it. The initial injury is neurological, but the effects ripple outwards.
So let's narrow the focus a bit now to individuals who use wheelchairs. How does CP specifically impact them?
Well, the core motor issues, posture, mobility, muscle tone, are obviously central, but relying on a wheelchair brings its own set of challenges and potential secondary problems.
Like what?
Pressure sores are a big one. Sitting for long periods puts pressure on certain spots.
Right, skin breakdown.
Exactly. Also, joint contractures. Muscles get tight, movement is limited, so joints can kind of get stuck in one position.
Painful, I imagine.
Can be, and definitely limits function. Scoliosis curvature of the spine is more common too, partly from posture and muscle imbalance. Hip dislocation is another risk.
Wow.
And as I mentioned, reduced weight bearing means lower bone density, so a higher risk of fractures.
So the wheelchair, while essential for mobility, needs careful management itself to prevent other issues.
Absolutely. Think of a child with severe spastic quadriplegia affecting all four limbs. They might use a special type of wheelchair, maybe a tilt-in-space one, precisely to help manage tone and shift pressure.
Tilt in space. We should definitely come back to that.
Yeah, we will. It's part of that daily management piece.
Okay, perfect lead-in then.
Yeah.
Let's shift to that second area, evidence-based caregiving, specifically thinking about personal care and hygiene, like bathing.
Right. This can be a real challenge for caregivers. Safe transfers are absolutely key here.
How do people manage?
Well, sometimes a bed bath is the safest option if mobility is very limited. But often, adaptive equipment makes a huge difference in the bathroom.
Like what kind of equipment?
Things like bath chairs or benches that sit in the tub or shower, providing stable seating. Bath lifts can help mechanically lower and raise someone into the tub.
Okay.
Handheld shower heads give the caregiver more control, and roll-in showers are great because they eliminate the tub barrier altogether.
Makes sense. And safety must be huge in the bathroom.
Oh, absolutely critical. Slips are a major danger, so non-slip mats, grab bars essential, and being super careful with water temperature, especially if sensation is affected.
Who helps figure out the best approach?
This is really where occupational therapists, OTs, and physical therapists, PTs, are vital. They assess the individual, the caregiver's ability, the home setup,
Right.
and then recommend the safest, most practical methods and equipment. It's very individualized.
And what about other personal care, like toileting?
Similar challenges there. A standard toilet might just not work, unsafe, poor positioning.
So adaptive options again.
Exactly. There are various adaptive potty seats or toileting systems that offer different levels of support. And again, therapists are key in selecting the right one. It's about safety, proper posture, and dignity too.
Okay, that makes sense. Let's move on to daily management then. A huge part of this for wheelchair users is, well, the wheelchair itself.
Definitely. The wheelchair isn't just transport, it's often their main seating and positioning system. Choosing the right one needs expert input, OTs and PPs again.
What are the big choices? You mentioned manual versus power earlier.
Right. That's a fundamental decision. Depends on physical strength, endurance, cognitive ability, the environment they'll be in, independence goals.
A lot of factors.
Yeah. For example, someone with very significant physical limitations, maybe at what's called GMFCS Level V,
The MSCS.
Gross Motor Function Classification System. It's a way to categorize motor function levels in CP. Level V is the most severe limitation.
Got it.
So, someone at level V might use a manual chair pushed by a caregiver, though some might use highly specialized power chairs. Someone at level 5E might use power mobility out in the community, but maybe a manual chair or walker at home.
Okay. And you mentioned tilt in space before. Why is that feature so important?
Yes. Tilt in space, or TIS, it's often really crucial, especially for those at levels 5E and V. It lets you tilt the whole seat and backrest unit backward together.
Keeping the hip and knee angles the same.
Exactly. The number one benefit is pressure redistribution. Tilting shifts the pressure off the sitting bones, which drastically cuts the risk of pressure sores. You often need a pretty significant tilt, like 45 degrees or more, for good relief.
Okay, pressure relief. What else?
It provides postural support against gravity, which can be huge. It can help manage muscle tone spasticity, sometimes decreases in a tilted position. It can reduce fatigue, improve head control for eating or communication,
Uh,
and even help with breathing sometimes. So lots of potential
it
benefits.
sounds like a standard off-the-shelf wheelchair probably isn't going to cut it for many people with CP.
Generally, no. Because CP affects everyone differently, you usually need custom seating components. It's all about individualization.
So what does that involve? Custom cushions.
Yes, starting with a stable base, often specialized cushions, maybe pelvic belts or supports to keep the pelvis positioned well.
Okay.
Then adding trunk supports like side pads, maybe a specific headrest for head and neck alignment, and making sure the leg rests and foot plates are configured correctly for that person.
It sounds very precise.
It has to be. For some people with severe scoliosis or other fixed deformities, they might even need a custom molded seat shaped specifically to their body.
Wow. And the goal of all this customization.
It's really about promoting symmetry as much as possible, providing stability so they can function better, ensuring comfort, obviously, and either preventing deformities from developing or accommodating ones that already exist.
We've talked a lot about positioning in the wheelchair. What about other times, like sleeping?
Great question. That falls under what's called 24-hour postural management. It's realizing that good positioning isn't just a daytime wheelchair thing.
Right, you spend a lot of time sleeping.
Exactly. So using pillows, wedges, foam rolls, or specialized sleep systems can help maintain alignment, support limbs, manage tone and contractures, prevent pressure spots, and just improve sleep quality.
So actively positioning someone for sleep.
Yes. And changing position during the night, if possible, is also important. Some sources even mention that lying prone face down can be good for stretching certain muscles and encouraging head control, but that needs careful implementation.
Okay. What else is part of this 24-hour management?
Standing. Regular use of standing frames is often recommended.
Standing frames. Even if someone can't stand on their own?
Yes. They provide support to allow standing. It gives crucial weight bearing through the legs, which is important for bone health.
Ah, for bone density.
Exactly. It also provides a good stretch for tight muscles in the hips, knees, ankles. It can help with circulation, breathing, even bowel and bladder function.
And just being upright probably feels different, changes perspective.
Absolutely. Good for social interaction, too. How long and how often someone uses a stander depends on their tolerance and goals.
It sounds like therapy must be a constant, essential part of life.
It really is. PTs and OTs are central here, designing exercise programs tailored to the individual.
What kinds of exercise?
Stretching and range of motion are fundamental. Trying to prevent or slow down those contractures we talked about
How do they do that?
could be passive stretching by a caregiver, active assisted where the person helps, or prolonged stretches using positioning, splints, or orthotics. Some research suggests longer, gentler stretches might be better for spasticity than quick, forceful ones.
Interesting. What about strengthening? Is weakness also an issue?
Yes, muscle weakness is a primary part of CP, and it can get worse from lack of use. So strengthening exercises are really important for function, things like transfers, posture.
What do those exercises look like?
Could be using resistance bands, light weights, doing functional activities that challenge muscles like reaching. And hydrotherapy or aquatic therapy is often fantastic.
Therapy in the water.
Yeah. The buoyancy makes movement easier, less stress on joints. The water provides resistance for strengthening. The warmth can reduce spasticity.
Sounds like it could be fun too.
Often is. It can improve range of motion, strength, balance, endurance, provide sensory input. Lots of benefit.
You mentioned functional activity training too.
Right. Basically, practicing real-life, meaningful tasks, making sure the therapy translates into everyday skills.
Are there other assistive devices people might use besides wheelchairs?
Yes. While wheelchairs are key for many, some individuals, maybe at that GMFCS level 4 who have some walking ability, might use walkers or gait trainers.
Gait trainers.
Yeah, they offer more support than a standard walker, sometimes with trunk or pelvic supports, maybe a seat, used for limited walking or for therapy. Standing frames, as we said, are crucial too. There are different types of standers as well.
So a whole range of equipment to support mobility and posture.
Exactly. It's all about finding the right tools for that individual's needs.
Now, caring for someone with CP, especially with complex needs requiring wheelchairs and therapies, it must be incredibly demanding for caregivers.
Oh, absolutely. The sources really emphasize this. It's often a lifelong commitment, physically, emotionally, and financially challenging. Caregiver well-being is not optional, it's essential.
What are the risks for caregivers? Burnout.
Definitely burnout. Stress, fatigue, irritability, feeling overwhelmed, sleep problems, maybe withdrawing socially. Recognizing these signs is the first step.
And that's where respite care comes in.
Precisely. Respite care is basically arranging temporary care by someone else, trained professionals, volunteers to give the primary caregiver a break.
A break to recharge.
Yes, to rest, take care of their own health, handle other things. It's critical for preventing burnout and sustaining care long term.
Does respite benefit the person with CP too?
It can, absolutely. It can offer new social interactions, different activities, a change of scenery, maybe in another setting like a group home, day center, or even a camp.
How do families find respite care?
There are resources. Organizations like United Cerebral Palsy often have local chapters. There are national respite networks. Building a support network of family and friends is also vital.
Using the whole team.
Exactly. Leaning on the therapists, doctors, social workers for guidance, and just basic stress management for the caregiver, self-care, breaks, setting boundaries, seeking help when needed. It's all part of the picture.
This has been incredibly thorough. A real deep dive, as promised. If you had to summarize the key takeaways for our listener, what would they be?
Okay, I'd say CP is complex. It stems from early brain injury, affects motor control, and often comes with other health issues.
Right.
For wheelchair users, good care means understanding the medical side, using safe, evidence-based techniques for personal care like transfers,
Right.
and having solid daily management routines. That includes the right wheelchair setup, customized seating, tilt in space if needed.
And the 24-hour positioning.
Yes, 24-hour postural management, thinking about positioning day and night. Plus, tailored therapeutic exercise, stretching, strengthening, functional activity.
Yeah, supporting the caregiver.
Absolutely paramount. Recognizing caregiver needs, ensuring they get support and respite is crucial for everyone involved.
Well, this certainly gives a strong foundation. And as we said, hopefully this encourages you, the listener, to explore further based on what sparked your interest today.
Definitely. And maybe one final thought to leave everyone with. Considering all the advances we're seeing in technology and therapy, what does a truly inclusive, supportive environment actually look like for people with CP? And maybe what part can each of us play in helping create that?